We do begin our 9 o'clock show on your Tuesday morning with breaking news. The FDA and the CDC both recommending the use of the Johnson & Johnson vaccine should be put on hold.
Now we're waiting for the FDA to begin a news conference with an update on the situation. In the meantime, KCTV5 Savannah Rudisell has been following this story for us since it broke just a couple of hours ago. Savannah, local places are already pressing pause on administering this vaccine. What did you find out?
Yeah, Gina, the list just keeps growing here minute by minute of all the places that are starting to cancel some of their vaccination appointments. Most recently, we have all of Hy-Vee stores are now or at least temporarily pausing their Johnson & Johnson vaccine appointments. We broke the news just a little over an hour ago now that Price Chopper, Hen House, as well as Sunfresh markets, all of those belong to the Ball Foods pharmacies. They have all decided to contact anybody this week who has a Johnson & Johnson vaccination appointment and temporarily pause those for right now. Also finding out the entire states of Kansas and Missouri have decided to pause those Johnson & Johnson vaccines. We heard this from Dr. Lee Norman just a few minutes ago, and he assures us that there won't be much of a backup in the state's vaccination plans with this, even by pausing an entire brand of the vaccine. He says that in a couple of different production issues, there have been some delays and backups, so Kansas is actually mostly relying on the Pfizer and Moderna vaccines for right now. Doctors with the University of Kansas Health System say pausing the vaccine, it's not a cause for panic, but an assurance that the safety checks are working and the process here, they're trying to make it as transparent as possible. They believe that the symptoms, any of these adverse symptoms that we've heard with these 6 women, they'll show up in between 2 and 13 days. So if you got a vaccine more than 2 weeks ago, you should be in the clear. As in Kansas City, we had that mass vaccination event at Arrowhead where they administered Johnson & Johnson, but that was more than 2 weeks ago. Anyone who got the dose, again, should be fine. Now, medical experts are saying that pausing the dose, it should not be a cause for panic. Pausing this dose, they say, is a precaution.
I think you're likely going to be okay. I mean, when you think about a 1 in a million event, that's, you cross the street every day, you have a much higher chance of getting run over by a car. So I think what people need to be is don't freak out. I'll be going on in my life, but I would be very attuned to my body. And if I develop shortness of breath, if I develop leg pain, if I develop a headache, and I'm within 2 to 3 weeks of having had the Johnson & Johnson vaccine, I would immediately notify my healthcare provider.
So the single-dose Johnson & Johnson vaccine, that can last out for about 3 months as long as it's in a refrigerator. It has a much longer shelf life than the Pfizer or Moderna options as well. So there is a good chance that these doses won't necessarily go to waste as long as there is time to research and make sure that it is safe and effective before that 3 months is up. Again, we are still waiting to hear from experts with the FDA about what is the next steps, and we're going to bring you the latest just as soon as we learn more. Reporting live in Roland Park, Savannah Rudisell, KCTV5 News.
Okay.
Definitely a lot of questions still when it comes to this announcement from the FDA, and we are still waiting for their press conference this morning.
And our local doctors here echoing that same sentiment that you heard from the Emory University doctor there. Keep in mind, this is 6 women out of 6.8 million shots. This is a precaution that is under review right now. There will be more that comes from this, but the message this morning, do not freak out, although it may be concerning if you have received that shot. Missouri also just mentioning they will keep their Johnson & Johnson shots on hold until they get the go-ahead to use them once again.
And again, as soon as the FDA starts that press conference, we will bring it to you right here live.